Okay, this is the pharmacology PowerPoint. I'm gonna try to make these quicker because I have a tendency to really ramble, and I'm sorry if you can't really hear me. My mic doesn't work. I'm having to just use the regular speakers, and here I am rambling. Cool. Whatever. On with the PowerPoint. Right on. So, pharmacology, right? Study of drugs. So, a drug is a substance that is used to prevent or treat disease. Okay? Prescription drugs are drugs that are specifically limited to use under the direct supervision of a doctor, a veterinarian, because of potential danger, difficulty of administration, or other indications. Okay, so these are drugs that you can't just buy over the counter. You must have a doctor client patient relationship. You need a prescription. You cannot get these without going to see a veterinarian. Controlled drugs are also prescription drugs, but they're a special kind of prescription drug. They are drugs that have the potential for abuse or dependence, and they are classified into schedules 1, 2, 3, 4, and 5. 5 being the least dependent, 1 being the most dependent, according to their level of abuse potential. Prescription rules. So they're rules that our government makes us do. Any prescription that leaves the building has to have certain things on it. So everything that leaves the building has to have a label. We need to have the clinic's info, the patient's info, what date, what the drug is, how the drug is to be given, where it's supposed to be given, and how much of the drug it is. The strength, the concentration, how many, how is it getting dispensed, what it is. So every drug's got to have a label and all this other shit written on it. Controlled drugs also got rules. Controlled drugs must be kept in a lockbox that is mounted to a wall that has two locks, two different locks. So one key to open one lock, one key to open a second lock. Every controlled drug, every ounce of controlled drug that is removed from the box has got to be written in a controlled drug log. Controlled drug log is a book or a binder, something not on the internet or computer. It is a manual, handwritten record that has the name of the drug, what schedule the drug is, the bottle number of the drug, because all controlled drugs are manually numbered, right? When we get a controlled drug in, we manually are writing what number drug that is in the log based on what number we got in the box. So the bottle number of the drug, the date, the patient that drug's going to, the amount that's being taken out of the bottle, the amount that's now left in the bottle after we took whatever we took out of the bottle, and the initials of who it is that's taking it out the bottle. This is big deal shit. If we don't accurately log the controlled drug binder, we could get fines from the DEA. Our doctors could get their license suspended and or completely revoked, and the clinic could get completely shut down. Big deal type of shit. Controlled drugs need to be on point at all times. Big deal. All right, routes of administration of drugs. Drugs encompass a wide variety of things, and they can go a wide variety of places. So we can deliver them lots of ways. So oral drugs. These are drugs that are given in the mouth. Parenteral drugs. These are drugs that are given by injection. So intravenously, intramuscularly, subcutaneously, etc. Any drug that's given via an injection, a needle into the skin. So then you have topical drugs. These are drugs that are placed onto the skin or the mucous membranes. So eye meds, ear meds, even rectal medicine. All those are topical drugs. And then we have inhalant drugs. So these are drugs that are liquids that are then vaporized and inspired, and they're breathed in as a gas by the use of a vaporizer or nebulizer. So you have anesthetic inhalants, but you also have things like albuterol and stuff, like inhalers for asthmatic cats. So on the bottle of every drug that we have, it has a labeled strength and or concentration. So every pill bottle that you see, you're going to be able to see what that medication is and how many milligrams is in that pill. But it's not always milligrams. Sometimes you're going to have drugs that are not in milligrams. They may be in grams, they may be in micrograms. Majority of the time, drugs are going to be listed in milligrams, but there will be drugs that you encounter that are not milligrams. But for all intents and purposes, usually you're going to have a milligram drug. I can name like 4 drugs off the top of my head that we have that are not in milligrams. But every drug is going to tell you how much of that drug is inside of a pill or a mil. So on pill bottles, it's going to be like 250 milligrams is in one pill. In injectable drugs or in liquid drugs, it's going to say how many milligrams per milliliter. So when you pull up in a syringe 1 single mil, that's going to tell you how many milligrams are in 1 milliliter. Now, there are some drugs that for some reason they don't list mg per mil. They'll list mg per 5 mils, which is fucking stupid, like oral gabapentin, which is 250 mgs per 5 mils. I don't know why they want to list it per 5 mils. Why don't we just list it per mil? Whatever. But every drug will tell you a strength and concentration. Drug dosages. So every drug has a labeled strength and or concentration, but every drug also has a drug dose. But majority of the time, the drug dose is not going to be on that drug bottle. Majority of your doses are going to be found in like medical textbooks, specifically PLUMs. PLUMs is like the pharmaceutical drug dosage fucking veterinary Bible, okay? The reason for this is that there are multiple dosages depending on what you're using that drug for. Because there's drugs that don't just do one thing, you know? There's dosages for, there's immunosuppressive doses of corticosteroid. There's anti-inflammatory doses of corticosteroid. So your dose for one drug is not going to be the same across the board because you're going to be using it for different things. So the dose is the prescribed measured amount of the drug. So the concentration is how much of that drug is in that pill or in that mil. The dose is how much of that pill or that mil we are giving to our patient, right? The drug dose tells us how much of the drug we are administering to the patient. So in order to calculate a drug dose, we need to know the patient's weight, because most of these drug dosages goes by patient's weight. We need to know what the patient weighs. We need to know what the strength of the drug is, and we need to know the recommended dosage for the drug. And that's how you find a drug dosage. I didn't get into drug dosage calculations. That's going to be a whole nother PowerPoint, but I will happily make that for you if you guys are interested. Drug categories. I cut out some categories. I'm going to do another second supplementary PowerPoint of other categories. I wanted to get most of the biggies in here. So in this PowerPoint, we're going to have your antibiotics, your GI drugs, your analgesics and anti-inflammatories, cardiac drugs, endocrine drugs, urinary drugs, antihistamines, antifungals, rescue drugs, so like your CPR drugs, anesthetics, and sedatives. What I did not include in here is topicals, antiparasitics, and preventatives. That's going to be his whole other thing. I'm going to make a whole separate PowerPoint for that one. Antibiotics. So before we talk about what antibiotics we got, we need to talk about what the hell an antibiotic is. So a bacteria is a single cell microorganism that usually, most of the time, has a cell wall, and they're either rounded, rod-like, or spiral-shaped. Antibiotics are used to stop bacteria, okay? So a bacterial infection is a disease or an illness that is caused by bacteria that have invaded tissues. And that is what antibiotics do. They stop bacteria. They don't do shit for viruses. Viruses are a whole nother thing. Antibiotics stop living microorganisms known as bacteria. So an antibiotic is a drug or a chemical that has the ability to either kill bacteria, which is known as bactericidal, like suicidal, like killing, or stopping their growth, which is bacteriostatic. So antibiotics either straight up kill the bacteria or stop them from being able to reproduce or multiply. Antibiotics are typically either narrow spectrum or broad spectrum. So narrow spectrum is they are effective against a limited range of bacteria types. And broad spectrum is they are effective against a wide variety of bacteria types. Now that we're living in the future, the majority of our antibiotics are broad spectrum. But back in the gap, there was a lot of antibiotics that we would use that were narrow spectrum. So first up is the penicillin family, like the oldest of the old, the OG of antibiotics, penicillin. We have Pen G in the fridge. We keep it around. We don't really use it that much, but it is in the refrigerator. So it is a narrow spectrum injectable antibiotic that only kills penicillin sensitive gram-positive bacteria. So it's used for like bacterial pneumonia, upper respiratory tract infections. Sometimes it's given prophylactically for surgery. Prophylactically means like we're giving it, why can't I even speak? I've been awake for 12 hours. Prophylactically is like you're doing it before the bad thing happens. Like we're giving it like a just in case kind of a thing. Pen G is kept in the fridge. You give it IM. We really don't use it that much, but it is there. But it's an old school drug. We got better ones. All right, next up in the penicillin family, amoxicillin. So amoxi drops. This is a liquid, broad-spectrum oral antibiotic. It is used for amoxicillin-sensitive, gram-positive, and gram-negative bacteria. So it's commonly used for respiratory tract infections, cystitis, which is bladder infections, or bladder inflammation, I should say, soft tissue infections, and bacterial dermatitis. So that's your amoxi drops. I put pictures right here so you can see. I scoured the internet. I haven't slept. Next, we got Clavamox, which is amoxicillin plus clavulanate, which is a broad-spectrum oral antibiotic that comes in a liquid and it comes in tablets. So the tablets come in, I don't have a picture of these, but the tablets come in like little foil sheets of 14. So like you just pull your little foil sheet out and drop it in your little envelope. So these are used to treat skin, urinary, and respiratory infections, as well as sometimes like wound infections on the skin. All right, so that's your penicillins. Fluoroquinolones. So that is Baytril, your enrofloxacin. Enrofloxacin is the generic form of Baytril. Baytril is the brand name. So enrofloxacin is a broad-spectrum oral and injectable antibiotic. So the injectable comes in two sizes. We carry two sizes of injectable Baytril. You may have heard of it referred to small animal and large animal Baytril. So the small animal is 22.7 milligrams per mil, and the large animal is 100 milligrams per mil. You always want to dilute your 100 milligrams per mil with saline before you administer it into the body. Oh, I didn't even write how it can be given. IV or IM. Whoops. So these antibiotics are typically used for skin, urinary, and respiratory infections. But, little tidbit to keep in your brain, you should avoid Baytril in puppies that are between 2 to 8 months old because Baytril has the potential to close the epiphyseal growth plates prematurely. So it will make puppies stop growing before they should. So that's why we try to avoid it in puppies that are 2 to 8 months old, because we don't want to prematurely close their growth plates. And then we have clindamycin. So clindamycin is a broad-spectrum oral antibiotic. It comes in both capsules and a liquid, used to treat upper respiratory infections, skin infections, abscesses, dental infections, wound infections, and osteomyelitis, which is bone. So that's why clindamycin we usually use in teeth, because it's good for your bone. And what is a tooth? It's a bone, girl. Cephalosporins. So we got a couple of cephalosporins up in the clinic. I've only included antibiotics that we carry. There is 80,000 million other antibiotics in veterinary medicine. I'm only including the shit that we carry in-house, and I hope I have not forgotten anything because I did not take an inventory before I made this PowerPoint. So your cephalosporins. So you have cephalexin. So this is a broad spectrum. It comes in capsules. It's usually used to treat like skin infections, pyoderma, that kind of thing. Then you have cephalosporins. So this is another broad spectrum. This also does skin, but also bladder and respiratory infections too. Then we have Convenia. So Convenia is an injectable that's kept in the fridge. And the beauty of Convenia is it's a long-lasting antibiotic. Usually lasts about 14 days. So you give it as a sub-Q injection, and it treats skin infections. So this is really good for cats that are like kind of ferally outside, that get into cat fights and get big abscesses because they got bit. And then you just shoot them up with some Convenia for that cat bite abscess. So you don't have to chase a cat with some Clavamox, trying to chase this half wild feral ass cat down to give it some antibiotics. So love Convenia. It's not great for everything. It's mostly only good for skin, but still, it's a blessing for those folks that have cats that they can't medicate at home. Okay, now we got the tetracyclines. That's your doxycycline. We used to also carry minocycline. I don't know if we do, so I didn't include that in here. So doxycycline is another broad spectrum antibiotic. This comes in both capsules and tablets. Tablets are cheaper, or the capsules cheaper, but they're tablets you can quarter and cut. I can't remember. One or the other. But doxycycline is used to treat bacterial infections that are caused by like parasitic induced things like ehrlichiosis, toxoplasmosis, Lyme disease, leptospirosis. All of these are infections that are caused by ticks, fleas, rats, that kind of thing. But most notably, doxycycline is used in heartworm positive dogs because there is a bacteria that live on adult heartworms called Wolbachia that has a symbiotic relationship with the heartworm. So it is beneficial to the heartworm and the heartworm is beneficial to the Wolbachia. So the doxycycline kills the Wolbachia, which kind of hinders the heartworm a little bit because the Wolbachia was helping it out. But doxycycline also sterilizes adult heartworms so they can't reproduce anymore. Fun fact with doxycycline: if you are giving doxycycline capsules to cats, always follow that with a bolus of a syringe of water down the cat's throat, because doxycycline can cause esophageal strictures where the esophagus, it's like kind of swells, it's like esophagitis, if that capsule doesn't immediately get swallowed. So if the capsule kind of gets stuck on the esophagus for a little bit and they haven't swallowed it all the way, it can cause esophageal strictures in cats. So just flush it with water down the throat when you're done giving a doxycycline capsule to a cat, just so you prevent the risk of any esophageal strictures. Bam. And that was your antibiotics. Boo. We blitzing through this. GI drugs. So what the hell is your GI? That's your gastrointestinal system. So that is like your digestive organs, the mouth, the stomach, the intestines, the rectum. And here's a little term for you: antiemetic. So emesis means vomiting. So if we have an antiemetic that is not vomiting, so these are a type of drug that is effective against nausea and vomiting. So it prevents nausea and vomiting. It's an anti-nausea medicine. So here we go. Here's our antiemetics. So we have Cerenia, which is an injectable, but it also comes in an oral. So this is an antiemetic drug that is used to treat and prevent vomiting, nausea, and motion sickness. So you can give oral Cerenia, you can dispense oral Cerenia to a client, and they can give it at a higher dose before they take their pet on a road trip if they know that their pet has a history of like motion sickness, right? So if you got a pet that you know pukes in the car every time, there is a higher dose of Cerenia out there for you that you can give to your pet before you ever get in the car. And then once you pre-med that pet with that oral Cerenia, then you can get in the car and bada bang, bada boom, motion sickness is prevented. So fun fact about Cerenia, it has a pain control in it. So this is like relatively like a new discovery, but there is abdominal and visceral pain control with Cerenia. So it's really like a fan favorite with like GI surgeries, because not only is it preventing like nausea and vomiting in the GI, but also it's giving you like visceral pain control. Cerenia is recommended to be kept in the fridge because it burns like hell when it's given, because it's a sub-Q injection. It burns like hell when it's administered, so it's recommended to be put in the fridge. FYI, it can also be used off-label IV, and it does not burn. So if you have a patient that has an IV catheter that needs to get Cerenia, just push the Cerenia IV. It's off-label, but it is completely safe to give that Cerenia dose IV, and it won't burn. All right, on to the next antiemetic. Ondansetron, also known as Zofran. So this comes in an injectable and it comes in an oral. So this is an antiemetic drug. It's used to treat nausea and vomiting. So it doesn't really have anything special about it. It's just an anti-nausea medicine. Just shoot you up, or take a pill. Antidiarrheals, metronidazole. So technically, metronidazole is an antibiotic, right? But in dogs, it is used as an antidiarrheal. It is an antiprotozoal drug. So protozoa are single-cell organisms. They are not necessarily bacteria. They're a little bit different. But it's an antiprotozoal drug that's used for Giardia. So metronidazole is a treatment for Giardia. But metronidazole is predominantly used off-label to treat diarrhea, right? It's an antibiotic, it's an antiprotozoal, but in veterinary medicine, bitch, we use it for diarrhea. We only have it as an oral in the 250s and the 500s, but there is an injectable metronidazole. We just don't carry it. 40-Flora. So 40-Flora is a probiotic supplement. It's a little powder that comes in a packet that contains beneficial gut bacteria that provides like beneficial microflora. And those beneficial bacteria can help control diarrhea. But we also got Propectolin, which I really like. So Propectolin is a probiotic supplement, and it's got pectin, kaolin, and Enterococcus faecium. So it comes in a paste and a tablet, and what it does a couple things. It protects the lining of the GI tract. It also promotes absorptions of fluids in the GI tract, and it provides beneficial gut bacteria to the GI. So all of these things help soothe the stomach and reduce diarrhea. So we're pulling fluids out of the GI, so we're not like super hydrating and super saturating our feces, so it's not really wet and yucky. So it's like helping it firm up, you know? So those are our anti-diarrheal medications. Ooh, laxatives. So lactulose is a synthetic sugar. It's a syrup, and it tastes really good. And it's used to treat constipation orally. So it's given orally. And what happens is after it's given orally, it's broken down in the colon. And it makes like a chemical compound that pulls water out of the body and into the colon, kind of like osmosis. And when the water seeps out of the colon, it softens the stool that's all stuck up in there, which allows it to pass easier. But lactulose has another use. So lactulose can be given as rectally as an enema because it absorbs like liver enzymes that have gotten too high, that are like starting to cause like neurological problems, like encephalopathy, like hepatic encephalopathy, like liver disease that is so advanced that the toxins from your liver are now affecting your brain and your cognitive ability, okay? So you'll see this a lot in puppies that have portosystemic shunts, and they seize and they walk around in circles and they're ataxic and they just stand at the wall and head press. So we can give those puppies lactulose enemas, and it helps absorb all the toxins that are not being filtered out by the liver. And it helps them regain slightly normal mentation until they can get surgery to correct the portosystemic shunt. So, fun fact. That's cool, right? Like, shove sugar up your ass and, like, I fixed your brain problem. Ooh, all right. So H2 blockers, which is famotidine, which is Pepsid AC. It's not exactly an antacid. It works a little bit differently. Antacid is one class of drug. H2 blockers are a little bit different. So H2 blockers block the production of acid. So famotidine, which is Pepsid AC, it comes in injectable and it comes in an oral. So it is a type of antacid, but not exactly, that is used to treat GI ulcers, gastritis, and acid reflux. We used to give this drug a lot when we would give like a lot of non-steroidal anti-inflammatories to prevent ulcers. I typically don't see it being used that much here at Low Cost Animal Medical Center. But this is something that you'd see in hospitalized patients that are getting a lot of drug of any kind, just to like prevent any kind of gastric ulcers from like obscene amount of drug being given. Protectants. So that would be a sucralfate. This is also given in conjunction with famotidine to protect against ulcers. So sucralfate is an oral drug. So it's a tablet that you like crush up and put into a syringe, and you kind of like let it melt in water, and then you give it by mouth. Okay, this is a by mouth drug. I've heard a horror story of somebody that was making a sucralfate slurry, and after it dissolved, they put a needle on it and gave it IV, and the patient immediately died. Okay, so when we're putting sucralfate in a syringe and making a slurry, it's meant to go in the mouth. It's an oral drug, not an injectable drug. Anyway, so this is a drug that is dissolved into a slurry, and then you give it in the mouth. And what it does is it kind of coats the duodenum. So it's for duodenal ulcers. The duodenum is like the upper part of the small intestines. So it coats the duodenum, and it will cover, it will either cover an existing ulcer, or it will coat the duodenum to prevent an ulcer from forming. Radiopaque contrast media. This necessarily isn't like a GI therapeutic drug. This is a GI diagnostic drug. So it's barium. Barium is a liquid that is given in a very large quantity via syringes that coats the stomach and intestines and esophagus. And it's a radio-opaque liquid metal sulfate. So you give it through the mouth. It travels down the throat, the esophagus, the intestines, the stomach, all that. And when you shoot an x-ray, it shows up bright ass white because it's a metal. So we can see if there's something stopping the flow of barium. That would let us know if there's like something like a blockage, like an intestinal blockage. It lets us see how far something can go if there is an intestinal blockage suspected. Then we have our emetics. So just like we have antiemetics, things that we use to stop vomiting, there are instances where we want to make you vomit. So let's say we think you got a foreign body and something's stuck in there, and we believe it's in the stomach. Everything's just stopped at the stomach. We want you to puke, and so we give you apomorphine. So apomorphine, there's two forms of it. There's an injectable form, and there's a topical form, which is I don't like this form. It's a pill that you crush up and you put in a patient's eye. They don't like it. It's like, imagine getting sand in your eye. I don't even know who made this. Why? Whatever. Use the injectable. It's a dopamine agonist that induces vomiting in dogs. Don't use this in cats. It doesn't work in cats. If you want to make a cat puke, give it xylazine. It's used to expel foreign material via vomiting that a dog has eaten within 2 hours-ish, right? Because if it's been longer than 2 hours, it's probably made it past the stomach, especially if it's not a foreign object, but like something toxic or poisonous. If they've eaten a drug or they've eaten a plant or anything like that, and it's been over 2 hours, induction of vomiting is not going to help them anymore. It's already gone past the stomach. It's gone through the intestines. It's already being absorbed. Vomiting is not helpful in this case. Oh my God, my phone is ringing. I'm just going to let it ring. So like I said earlier, no apomorphine in cats. If you want to induce vomiting on cats, give them injectable xylazine. And then our next category is antidotes. That would be Toxaban. So let's say we got our patient and they've eaten something they shouldn't. We can either induce vomiting, or if it's been too long, we can just give them Toxaban. And even sometimes it's too late for Toxaban, but Toxaban is still, hopefully, can get a little bit of residual. So what Toxaban does, it's an oral liquid that's also given in large amounts via a syringe, and it binds to chemicals and drugs that have been ingested, so that it will hopefully lessen the effects of whatever has been eaten. This stuff is black, it is thick, and it gets everywhere. It's a nightmare. If you have not yet used Toxaban in your veterinary career, just you fucking wait. You're going to love it. It's going to be a great time. But we use Toxaban to basically absorb any medications or toxins or anything potentially harmful chemical-wise that a patient has ingested, to hopefully stop some of the absorption. I know that activated charcoal has gotten like popular with like toothpaste and shit, and like people drink activated charcoal teas. Just know that activated charcoal's job is to literally bind to medications so they don't bind to you. So don't like drink a drink that has activated charcoal in it if you're taking medicine, because it's going to make your medicine less effective, especially birth control. So if you ain't trying to get pregnant and you taking birth control, don't be drinking no activated charcoal tea or coffee or whatever. It's going to make your birth control not effective, girl. Ooh, analgesics and anti-inflammatory drugs. All right, analgesic drugs. These are drugs that reduce pain. So these include prescription, over-the-counter, and controlled drugs. Anti-inflammatory drugs are drugs that reduce inflammation, redness, swelling, and pain. So all anti-inflammatory drugs are analgesics, but not all analgesics are anti-inflammatory drugs. Does that make sense? So every anti-inflammatory drug is going to be a pain reducer, but not every pain medication is going to reduce inflammation. So moving on with anti-inflammatories, you got two types. You got non-steroidal anti-inflammatories, which are a very large class of drugs. Everybody here has taken anti-inflammatories at one point in their life. These work by reducing the body's production of inflammatory-causing chemicals called prostaglandins. But long-term NSAID use can cause liver and kidney problems, as well as gastric ulcers, especially in cats. Never, ever, ever, ever give a patient that's on NSAIDs a corticosteroid. So steroidal anti-inflammatory drugs and non-steroidal anti-inflammatory drugs cannot be given together at the same time. Steroidal anti-inflammatory drugs, so steroids, also known as corticosteroids, work by reducing the production of chemicals that cause inflammation, and they also reduce the activity of the immune system, so it reduces the body's natural response to inflammation. Corticosteroids have a tendency to make patients eat, drink, and pee more, but long-term steroid use comes with a long list of side effects, including decreased immunity, like prolonged wound healing, increased risk of infections, weight gain, and then iatrogenic Cushing disease, which is hypoadrenocorticism. So use it sparingly. And again, never give a patient that's on a corticosteroid an NSAID. It causes horrific gastric ulcers. Don't do it. You cannot combine the two. If you're going to do an NSAID, do an NSAID. If you're going to do a steroid, do a steroid. You can't flip-flop, not one or the other. Not I'm going to do one this day and one the next day. Nope. A course of one or a course of the other, not to be combined or switched or flipped. And the last category, opioids. So these are controlled drugs, also known as narcotics. They interact and bind to receptors on nerve cells in the body and brain that reduce pain. They do not reduce inflammation, right? They only work on your brain and body to make you perceive pain differently. Opioids can cause drowsiness, nausea, constipation, ataxia, and sedation. And because they're controlled, that means they have a potential for abuse. All right, NSAIDs. So we got a couple NSAIDs. So carprofen. This is our oral. This is our oral pain reliever. So it's our anti-inflammatory, typically used for like post-op dogs recovering from surgery, dogs that have osteoarthritis, dogs that have like recovering from like a partial ACL tear and they're on cage rest, that kind of thing. Then next up is meloxicam. So meloxicam and carprofen are literally almost the same chemical compound. The only difference is that meloxicam, also known as Ostelox or Metacam, comes in an oral and an injectable, where carprofen is, well, oral as in liquid. So meloxicam comes in a liquid oral and an injectable, whereas carprofen is a tablet, right? So meloxicam is your lower concentration oral for your little bitty kids, and it's off label for cats too. We can dispense this to cats, and your injectable. Basically identical to carprofen, like literally same fucking chemical component, drug mechanism. And then lastly, we have Onsior. Onsior is like the new kid on the block. So cats are really, really susceptible to like fucked up negative side effects of nonsteroidal anti-inflammatories. They're susceptible to the kidney and liver damage that nonsteroidal anti-inflammatories can do. So Onsior was created as a nonsteroidal anti-inflammatory specifically with cats in mind. It's a 3-day thing, like you give it for 3 days. It comes in an injectable and an oral. It's also on label for dogs too. They make higher milligram tablets for dogs. We don't carry it at low cost because we have carprofen and it's cheaper, but we do carry the small milligram of Onsior to cater to our feline patients. But Onsior is used for post-operative pain and inflammation, specifically designed for cats in mind, right? That's so nice. Now we're on to our steroids. So these are our corticosteroids. So we got prednisone and prednisolone. So prednisone and prednisolone are corticosteroids, oral corticosteroids. They come in tablets that are used to treat inflammation, pruritus. I wrote atopy. I'm just realizing that word is supposed to be pruritus. I've been awake all night. Addison's disease, immune-mediated diseases, certain cancers. So at a lower dose, prednisone and prednisolone are anti-inflammatory drugs. At higher doses, they are immunosuppressive drugs. So for patients that have immune-mediated diseases, like autoimmune diseases, like immune-mediated hemolytic anemia, where their body is literally destroying their own red blood cells and making them anemic, we give them high doses of corticosteroid to wipe out their immune system so their immune system stops attacking their red blood cells. Prednisone and prednisolone are almost identical chemically, but prednisolone is absorbed better in cats than prednisone is. So we keep prednisolone on hand because if we were going to use pred and it's a cat, we're going to give it prednisolone. All right, Timerol P. So Timral P is two drugs in one. It's actually prednisolone and an antihistamine. So Timral P is used for allergies, itching, coughing, and inflammation and irritation of the throat. Also used for like bronchitis. Um, so basically, it's used for allergies of both the skin and upper respiratory. Um, I don't really see it prescribed that much, but we carry it. But yeah, it's an antihistamine mixed with a corticosteroid. And now we got our two injectables. So we got dexamethasone XP. This is a corticosteroid that when you give it, it's usually given IV. I think you can off-label give it IM. I didn't check. I've only ever given this drug IV. It's got a rapid onset but short duration of action. So it is used to treat like severe allergic reactions like anaphylactic shock, inflammation, pruritus, and it can also be given as a part of a test for Cushing's disease. Like we do a low dose dex test, where we give patients like a low dose of dexamethasone SP and see how they react. Oh my god, I'm having acid reflux. Girl, I need some famotidine. But that's your dexamethasone. Then we have depomedrol. So depomedrol is also an injectable corticosteroid, but it's a long-lasting injection. It comes in two concentrations, a 2 mg per mil and a 4 mg per mil. So this is a corticosteroid that's given IM that treats pruritus, inflammation of allergic dermatitis, asthma, arthritis, and it can last, one injection, it can last 3 to 4 weeks. So this is like your go-to injectable steroid, especially for cats. Opioids. Now we're on the opioids. All right, we got a couple here. So, butorphanol. So, this is a controlled drug. It's an injectable. It's a partial opioid agonist. It is a class 4 controlled drug. It is a pain management drug. It is about 4 to 7 times, it has like 4 to 7 times more pain relief than morphine. It is also used as a pre-anesthetic drug, so a drug that is given before we induce anesthesia to allow us to use less anesthetic drug. And it's also used as an antitussive, which is a cough suppressant. It can cause drowsiness and sedation. So butorphanol is our injectable pain med used for mild to moderate pain, coughing, and a pre-anesthetic. Buprenorphine. All right. Buprenorphine is also a controlled drug. It's a partial mu agonist and antagonist. This is a class 3 drug. It's also used for pain management. So, fun fact about buprenorphine. So, we use this drug as an injectable pain med. It can be given IV, sub-Q, or IM, but in cats, it's also absorbed transmucosally. So, we can draw this drug up in a syringe, and a couple syringes, and take the needles off of the syringes and just put caps on and send the drug home with the client, and the client can dose buprenorphine on cats at home by just putting it on the cat's mucous membrane, and it absorbs beautifully. It is a great option for super painful cats that have had super painful procedures or super painful fucking conditions where they need extra pain meds, you know? Buprenorphine can cause drowsiness just like butorphanol can. But because buprenorphine is a mu agonist and antagonist, you cannot give other opioids with buprenorphine. They do not work. You cannot give any other opioid with buprenorphine. Buprenorphine is also known as Suboxone. I don't know if any of you guys are familiar with that drug, but it's used to like treat opioid addiction in humans. Because when you take buprenorphine, you kind of get like a little high, but also if you want to shoot heroin, it doesn't work. You don't get heroin high when you're on buprenorphine. It blocks those opioid receptors from ever reacting. Buprenorphine just kicks all the opioids off. So Suboxone is like a medication of choice for people that are trying to like kick an opioid addiction. And lastly, we have tramadol. So tramadol is our oral opioid. It's a synthetic opioid. It is a Schedule 4. It used to not be a scheduled drug, but hey, man, people be abusing everything out here. So it's a Schedule 4 synthetic opioid that is used for pain management. So tramadol is best used in conjunction with another pain medication. So like multimodal analgesia, you want to use it in conjunction with something else, because recent research has kind of been showing that tramadol just like isn't as effective pain management wise as it was originally like thought to be believed. So typically tramadol is usually piggybacked with like carprofen, like a not like a non-steroidal anti-inflammatory, just to like help it along, because it doesn't do as much as originally we thought it did. And also tramadol tastes like shit. God, I wish somebody would invent a tramadol that tastes good. Have you ever tried to pill a dog with tramadol? It's bitter, bitter, bitter. God, they hate it. They hate tramadol. Tramadol tastes like shit. Somebody please invent tramadol that tastes delicious, please. And then our little bottom category here, gabapentinoids. Gabapentin gets its own category. It's gabapentinoid. Gabapentin is currently not a controlled drug, but it is well on its way to be, because it does have a potential for abuse, especially when it's used in conjunction with other drugs. So gabapentin is an oral medication. It can come in capsules and liquids. It is an anti-seizure, anti-anxiety, and a pain management drug that is used to treat idiopathic epilepsy, behavioral issues, and chronic pain, specifically pain involving nerves. It is a nerve pain medication. Gabapentin is also best used in conjunction with another medication, whether you're using it for behavioral issues, anti-anxiety issues, or pain control. Gabapentin is not a one like solo one and done kind of a drug thing. It works better synergistically with another drug. It is a helper drug. It helps out other drugs when given with other shit. So you want to give like gabapentin and trazodone for anxiety and behavioral issues, and you want to give like gabapentin and buprenorphine, or gabapentin and fucking carprofen for pain, or prednisone. Like, you want to give it with something else, and then you can have beautiful, excellent pain control. Ooh, next section, cardiac drugs. So the cardiac system, the cardiovascular system, is the system that circulates blood and oxygen throughout the body. That is the heart, lungs, veins, arteries. Woo. So congestive heart failure. Congestive heart failure is a chronic condition where the heart is no longer able to pump blood as effectively as it should be able to. So there's two ways of getting like congestive heart failure. So there is either the walls of the heart have become really thick. So when the heart is beating, because the walls are so thick, the blood can't fill the chambers of the heart. So that is called hypertrophic cardiomyopathy. And the second form of congestive heart failure is when you have the cardiac muscles are really thin and weak and really stretchy. So the chambers of the heart have really stretched out. And so they're not able to effectively contract and pump. So they don't have that good contractility or strength to pump. So that is dilated cardiomyopathy. So hypertrophic cardiomyopathy, those thick walls that don't have good chamber filling, that is usually a cat thing. Dilated cardiomyopathy, where you have thin, weak, stretched out chamber walls that are just flopping in the breeze and don't have good pumping power, that is usually a big dog thing. So symptoms of congestive heart failure include coughing, dyspnea, which is difficulty breathing, exercise intolerance, fatigue, cyanosis, which is your blue mucous membranes, fluid buildup in the extremities, which is edema, and ascites, which is like fluid buildup in the abdomen. And then we have mitral valve disease, which can also cause congestive heart failure. So mitral valve disease is a degenerative condition that is usually a small dog thing. So dilated cardiomyopathy, big dog; mitral valve disease, small dog. So the mitral valve is the valve in the left side of the heart that connects the left atrium and the left ventricle. So the left top part of the heart and the left bottom part of the heart is the valve that connects the two. So what happens with mitral valve disease is that over time, the mitral valve degrades. It usually gets thickened, or the pieces of the heart that tether the valve get strained or broken or snap, and the valve becomes leaky. So what happens is, as the heart is pumping, the mitral valve begins to leak, and you get some blood regurgitation back into the atrium from the ventricle. So as the atrium is pushing blood into the ventricle from the mitral valve, not all of the blood is going into that ventricle, and some of it is regurgitating back down into that atrium. So when you hear a heart murmur, that's what you're hearing. You're hearing the mitral valve. Typically, you can have a murmur in other valves, but most notably, typically, it's going to be your mitral valve regurgitation that you're hearing on the left-hand side, because it's early mitral valve disease in your older little dogs, where that heart is pumping and that mitral valve is degenerating, and you're getting blood regurgitating back into the atrium, and it's going to get progressively worse. So that's why we grade these heart murmurs. And you'll notice that as patients get older, their heart murmur gets worse. They come in as a grade 2, then it's a grade 3. Next year it's a grade 4. We're recommending they get a cardiac workup, because mitral valve disease is degenerative. And over time, this backup of blood into the atrium is eventually going to back up the blood into the lungs, which is going to cause congestive heart failure. So that's why we keep an eye on these heart murmurs, and we grade them, and we make sure that owners are well informed that their dog has a heart murmur, and that there may not be any concern right now, but in the future it can potentially be problematic, and they may become symptomatic of congestive heart failure because there is a potential that they have mitral valve disease. I kind of went on a tangent, and I'm sorry. On to the cardiac drugs. All right, so Vetmedin, also known as Pimabendin. So this is the oral drug that is used for congestive heart failure in our dogs. So this is for our dilated cardiomyopathy and our mitral valve disease. So this is for our thin, weak, stretched out, weak-ass heart chamber walls that can't pump good. They flop in the breeze. And our mitral valve that's regurgitating blood back into the atrium. That's what this drug is for, Vetmedin. So what it does is it opens up the blood vessels that carry blood to and from the heart, so the heart doesn't have to pump as much, right? The heart doesn't have to work as hard to get the blood in and out of the heart. It also increases strength and efficiency to the heartbeat, which improves overall pumping action. So, congestive heart failure, there's not a cure for it. Once a patient gets put on Vetmedin, this is going to be probably something that they're going to be on for the rest of their life. This is a drug that is going to maintain their ability to have normal-ish cardiac function. They're going to be on it for forever. Then you got your ACE inhibitors, which is enalapril. So in human beings, enalapril is a blood pressure medication for high blood pressure. In dogs, it really don't do much for blood pressure, but it's great for congestive heart failure. It's an oral medication that it treats congestive heart failure because it prevents the production. It's an ACE inhibitor. It inhibits an enzyme that causes vasoconstriction of blood vessels. So enalapril allows blood vessels to relax, which reduces strain on the heart. So again, there is no cure for congestive heart failure. Once a patient is put on enalapril, they are most likely going to be on enalapril for the remainder of their existence. Like, that's all she wrote. This is a maintenance drug that is keeping this dog at a pseudo level of kind of okay normal cardiac function. And lastly, we got your diuretics. So this is your furosemide, also known as your Lasix or your Salix. So this comes in both oral and injectable form. So what this does, a diuretic, it diureses. It pulls excess fluid out from the body and excretes it via urination. So in patients that have congestive heart failure, they typically will have a buildup of fluid in the lungs, a buildup of fluid in the limbs, a buildup of fluid in the abdomen, just because of all the fluid backed up into the heart because their heart's not pumping effectively. So furosemide takes all that excess fluid and lets them pee it all out so they're not a big fucking water balloon. This is going to make your patients pee excessively. And this can cause dehydration if you do not offer water frequently to this patient. So do not ever recommend that a client withhold water because they may be concerned that they put their pet on furosemide and now he's peeing all over the place. So now they want to restrict water intake so he doesn't pee. Well, that's a problem because now he's going to become dehydrated because he's not retaining any of his fluids. He's on a medication that makes him pee it out constantly. So water really should be offered to patients on furosemide pretty much at all times to prevent dehydration. So if you got a patient that's on furosemide and their mama asks, can I just limit his water? The answer is no. He's going to get dehydrated. No. Ooh, we're on endocrine. I don't even know how long I've been in here for. All right. The endocrine system. So this is a chemical messenger system of feedback loops of hormones. So hormones that are released by glands that release hormones into the bloodstream that regulate metabolism, growth, development, sexual function, sleep, mood. Basically, the chemical makeup of who you are as a person, that's thanks to your endocrine system. So like some of your endocrine glands include your adrenal glands, your thyroid gland, your pituitary gland, your pineal gland, your sex organs, your pancreas, all those endocrine glands. Some endocrine diseases. So diabetes mellitus, that's sugar diabetes. So this is a chronic condition in the body, which specifically involving the pancreas usually, where it doesn't make enough of the hormone insulin. So your pancreas creates insulin, and when you have diabetes mellitus, your pancreas ain't creating the insulin. Or your pancreas is creating insulin, and for some reason, your body just doesn't know how to use it properly, which results in very high blood glucose levels. Next up, you got hypothyroidism. Hypothyroidism. Hypo meaning low. So this is a chronic condition in dogs where the thyroid gland does not produce enough thyroid hormone, which leads to decreased metabolism. So these dogs are fat. They have a dull, thin hair coat. They have very reduced activity. They have thickening skin. They almost kind of look like Ottomans. They have this really flat back, kind of keg-looking shape, and they're balding. They have a very classic look. And then you have hyperthyroidism. Hyper meaning increased. This is a chronic condition in cats. So dogs, hypo, never hyper. Cats, hyper, never hypo. So hyperthyroidism, chronic condition in cats in which the thyroid gland is overproducing thyroid hormone, which leads to an overactive metabolism. So this is when cats are voracious eaters, never stop eating, drink and pee a ton, but just continue to lose weight. Then they have this wild, unkempt, crazy hair coat. They kind of look a little greasy. Their heart rate is crazy high. They pee a whole lot. They also have a very classic look. Hypothyroid dogs and hyperthyroid cats are very distinctive looking. Drugs for these issues. So insulins. This is the drug how we treat diabetes mellitus. There's also another type of diabetes called diabetes insipidus, but it's not very common, and so I didn't include it in here. So that is bitter diabetes. Diabetes mellitus is sugar diabetes. So diabetes mellitus, you treat it with insulin. I've listed 3 types of insulin here. There are a bajillion other types of insulin, but these are the 3 most common that you're going to see. So Humulin N, also known as NPH. So this is, firstly, all these insulins are injectable and they all need to be kept in the fridge. But Humulin is NPH. It's an intermediate acting insulin that is dosed by units using a U100 insulin syringes. There are two types of insulin syringes. You must use the correct insulin syringe size in order to properly dose insulin. The box of insulin will tell you exactly what syringe you should be using, either the U100 or a U40. So Humulin is a U100 insulin syringe. You give the insulin sub-Q twice a day after a meal. So it usually lasts 12 hours in dogs, but Humulin is not really recommended in cats. Vetselin. So this is an injectable intermediate and acting insulin that is dosed using a U40 syringe. Different syringe. Very important. There is no calculation from a U40 to a U100. You cannot calculate the two. For a U40 insulin, you got to use a U40 syringe, period. So this is also given sub-Q twice a day after a meal. This you can also use both in dogs and cats. And I got it in big bold letters about the U100 and the U40s. It's a big deal type of shit. You don't want to fuck it up. You're going to misdose your pet if you use a U100 syringe on U40 Vetselin. And then Lantus. So Lantus is a long-lasting insulin. I think this one's super fucking expensive. This is a long-lasting insulin. This one's commonly used in cats, but you can also use it in dogs. So this is dosed with a U100 syringe. It's sub-Q, give twice a day, given after a meal. So it is a long-lasting insulin, and in human beings it's used every 24 hours, but cats have a super fast metabolism, and so in cats it's still recommended to give it Q12 every 12 hours, despite it being longer lasting than Humulin or Vetselin. Alright, endocrine drugs for the thyroid. So levothyroxine, thyroid tabs. This is to treat hypothyroidism in dogs. So hypothyroidism in dogs, they don't have any thyroid hormone. So what do? We give them thyroid hormone. That's what levothyroxine is. It's a synthetic thyroid hormone. It's to supplement the missing thyroid hormone from hypothyroid canine patients. So hypothyroidism is not curable. There is no cure. If you're hypothyroid now, you're going to be hypothyroid for life. So once a patient is prescribed levothyroxine, also known as thyroid tabs, they're probably going to be on this medication for the duration of the rest of their life. Methimazole. This one's different. This one's for your hyperthyroid cats. So this one comes in an oral and a topical, a transdermal gel that you can put on a cat's ear, because methimazole tastes like shit and cats don't like things that taste like shit. So what this drug does is it stops the body's ability to produce thyroid hormones in hyperthyroid feline patients. So this is not a cure for hyperthyroid. So they're going to have to be on this drug for the rest of their life too if they do not want to pursue other options. There are other options for hyperthyroid cats like radioactive iodine. There's a diet they can go on. But if they are not interested in doing those things, or those things are not available to them, or they've tried and failed, then they're going to be on methimazole for the remainder of their existence. Urinary. So the urinary system is your kidneys, your bladder, your ureters, and your urethra. Your urinary system eliminates waste from the body. It regulates blood volume. Oh, that's supposed to say volume. It regulates blood pressure. It controls levels of electrolytes and metabolites, and regulates blood pH. Incontinence. So incontinence is uncontrolled release of the bladder. So this can be either like a full whole stream of urination of bladder emptying, or like small dribbles and leaks of urine. So usually incontinence is caused by a problem with the urethral sphincter, which are the muscles that close off the exit to the urethra. And typically you see this in spayed female dogs, because there's like a spay-induced incontinence thing that has to do with displaced ureters and estrogen. I used to know all these things, but that information has not served me in so long, so that's gone out of my brain. But something about spayed females and the lack of estrogen and displaced ureters and spayed bitches pee on themselves. A lot. Alright. Urinary obstruction. This is a life-threatening blockage of the lower portion of the urinary tract. This is usually a male cat thing, and it's most likely caused by stones and or crystals. So we got 2 drugs in this section, because the other urinary shit's going to be like antibiotics. So first we got Proin, also known as phenylpropanylamine. So this is an oral medication that is a class 5 controlled drug that is used to control urinary incontinence because it tightens the bladder sphincter muscles that helps to control urine leakage. So a lot of people are like, why the hell is Proin controlled? It's not like a pain medicine. It doesn't have any sedative effects. Well, Proin, firstly, it's not controlled in all 50 states, but in Louisiana it is. But Proin has an ingredient in it that you can make methamphetamines out of. So that's why it's controlled, because you can make meth out of it. So that's why it's in your lockbox. But that's what it does. It tightens the urinary sphincter, so you don't leak pee everywhere. And then prazosin is our only other urinary drug on this list. So prazosin is an alpha blocker. So this is an oral capsule that is used to relax smooth muscles that are associated with the urethral sphincter in animals, specifically usually cats, that are having urethral spasms because of a urethral obstruction. So when cats have a urethral obstruction, whether they currently have the obstruction or we've just removed the obstruction, they will typically have urethral spasms where their urethra just literally just contracts and releases and contracts and releases and contracts and releases. This makes it hard to pass a catheter, and this makes it hard for the patient to relax and allow urine to pass after we've unblocked them. So we put them on prazosin to help relax the smooth muscles of the ureter, both before a urinary catheter is placed, after the urinary catheter is placed, and once the urinary catheter is removed. Prazosin is usually used in conjunction with diazepam, which is a benzo that is also, diazepam is Valium. That is a benzo that is also like a muscle relaxer. So we use prazosin and diazepam together to kind of like smooth muscle it out, muscle relax the little urethra to let everything pass nice and smooth. Antihistamines. So a histamine is a biochemical that is released by our cells when they are responding to an allergic reaction. So histamines are the things that cause swelling, rashes, hives, itching, sneezing, upset stomach, and respiratory problems. So whenever you have like an allergic reaction, your eyes are itchy, you got hives all over you, that is a histamine response. Anaphylaxis is an extremely severe, potentially life-threatening allergic reaction where the immune system releases histamines, white blood cells, mast cells, and other substances that can cause tightening in the airways and difficulty breathing and can result in your ultimate demise. So we got 2 antihistamines in rotation, an injectable and an oral at the clinic. So diphenhydramine, that is the generic name for Benadryl. So we have it in an oral and an injectable. So what it does is it blocks H1 receptors to keep histamines away. So it reduces the symptoms of allergens. So it stops the allergy response. So we use injectable diphenhydramine with epinephrine and Dex-SP as a part of the treatment for acute anaphylactic shock. So when something comes in with anaphylactic shock and they're dying and their airways closing and they're syncopal and they can't breathe and everything's swollen, we use Dex-SP to reduce the inflammation, we use diphenhydramine to stop the histamine response, and we use epinephrine to open up airways so they can breathe. We're going to talk about epinephrine in the rescue drug section in a second. And then the other drug we have oral hydroxyzine. This is just an oral antihistamine that blocks histamine release and reduces the symptoms of allergies. It's very similar to oral Benadryl. Antifungal. So fungus, that is a kingdom of organisms that includes teeny weeny microorganisms like yeast and mold, but it also includes large multicellular organisms like mushrooms. So a fungal infection is a disease caused by a fungus. So the most common thing that you're going to see is like ringworm and malassezia, which is like yeast infection in the ears. So we got 2 antifungal oral drugs that you'll see. The first is terbinafine. So this is kind of a newer oral antifungal. So this one is used for the systemic treatment of ringworm and fungal skin conditions. And then we have ketoconazole, which is an oral antifungal that is used in the systemic treatment of fungal infections, including fungal ear infections. The ketoconazole is more effective against malassezia, like that ear yeast, than terbinafine is. But ketoconazole is also used for more serious fungal infections like valley fever and blastomycosis, so like fungal infections in the lungs. And ketoconazole is also an ingredient that's used in like buku ass ear cleaners. Rescue drugs. All right, cardiac arrest. So cardiac arrest, you dead. That's loss of heart function, breathing, which is respiratory arrest, and consciousness. You are unconscious and your heart is not functioning, right? Sometimes it can still be beating, like if you're in like VFib, but it's not a functioning heartbeat. It's just like going all over the place. Cardiopulmonary resuscitation, that's CPR. So this is an emergency procedure that is combining chest compressions, manual ventilation, so giving manual breaths, and rescue drugs being administered in an effort to preserve brain function in an attempt to revive a patient who is in cardiac arrest. So then we got our crash cart. So your crash cart is a toolbox or cart that is readily accessible and contains the equipment, medications, and drug charts required to treat a patient within seconds of a medical emergency. So the crash cart should be in a centralized location where everybody knows where it's at, and it should be checked and stocked regularly. So here is our 2 main rescue drugs. So we have epinephrine, which is adrenaline. So it is an injectable drug that when we are in a rescue situation, we are giving this drug IV. Always IV. This drug should not be given any other way except for IV. If you can't get this drug IV, do not give this drug sub-Q. Do not give this drug IM. Your patient is going to die before the IM or sub-Q drug will ever be absorbed in their body. Like, this is a drug that needs to be given and absorbed very quickly. So if you cannot get venous access on a patient that is in cardiac arrest and you want to administer epinephrine, put it in their trachea. Blow it down their windpipe. If you cannot get IV access to emergency drugs, if they have a trach tube in, or if you can get a trach tube in, or you just shove it down their throat, get in their trachea. The lungs absorb so quickly, much faster than a muscle will and much faster than the skin will. Think about smoking weed. Think about taking a fucking bong rip. When you exhale, you feel that shit immediately. That's just like dropping epinephrine into the lungs. Immediately. If you can't get it in a vein, put it in a lung. Epinephrine works by narrowing blood vessels, which increases arterial pressure, increases coronary perfusion. It bronchodilates, so it opens up all the airways in the lungs. It increases the heart rate. It increases the force of contractility of the heart. It also tells the liver to start breaking down glycogen into glucose, so you start getting blood sugar in the body. Basically, the adrenaline response is like the fight or flight mechanism kicking in, and it's like we gotta like do everything that we can to like live. So we're gonna open up airways so we can breathe. We're gonna dump a bunch of sugar in our fucking body so we have energy. We're going to constrict all our blood vessels so that our fucking heart can pump most effectively. That's what epinephrine is doing. And then we have atropine. It's an anticholinergic. So atropine is a drug that, again, you're going to give it IV. You need it to act immediately, or you're going to blow it down the trach. You're going to put it in your blowhole. But what this does is it increases the heart rate by making the SA node in the heart. So the SA node is a node inside of the heart that basically is the first part of the electrical system that tells the heart to beat. So it is literally the heart's natural pacemaker. It sets the pace of the heart and is literally the mechanism in the heart that's like, okay, beat now, beat now, beat now, beat now, beat now. It's what is making the heart go. So atropine goes to that SA node and is like, do it again, do it again, do it again, even faster. So combined with epinephrine and atropine, these two drugs are working on the body to be like, bitch, I need you to fucking breathe. I need your heart to beat as effectively and as quickly as possible. I need your body to make glucose and use it. I need your ass to live. And that's why these are rescue drugs. All right, I think this may be my last category. Anesthetics and sedatives. So anesthesia just means loss of sensation. That is it. Anesthesia is the loss of sensation. General anesthesia is the loss of sensation also without consciousness, reflexes, ability to move, memory of what has occurred, and it's usually induced and maintained with a combination of injectable and inhalant drugs, that's multimodal anesthesia, with the purpose of performing a surgical procedure, right? So in general anesthesia, we are unconscious, we have no reflexes, we cannot feel, see, hear, we cannot respond, we are unconscious. Local anesthesia is loss of sensation in one specific part of the body produced by topical or injectable drugs for smaller, less invasive procedures. Then we have sedation. So sedation is the reduced awareness of surroundings, stimuli, and sensations, almost a sleep-like state, okay? So it is the reduced awareness, sleep-like state. If I walk up to you and you're sleeping and I slap you in the face, will you wake up? Yes, you will. Sedated patients are not under general anesthesia. They are not unconscious and they can respond to stimuli. So if you have a patient that you are using only sedation on and you are doing something painful to them, let's say they have a wound that you're cleaning, or they have a broken leg that you're trying to set back in place, or they've been hit by a car and you're trying to take x-rays, and you only have a drug that produces sedation on board, they are going to wake up suddenly, randomly, and wildly while under sedation, and they will bite you and they will go back to sleep. So anytime that we are working with a sedated patient and we are doing something painful with them, beg and plead with your doctors to provide pain control, because you are going to get got. Do not let a sedated sleeping patient lull you into a false sense of security that they are harmless and you can manipulate any painful areas on them. They will wake up. If I stab you while you sleep, you are going to wake up and slap the fuck out of me. The same thing is true with a dog under sedation. They are not under anesthesia. There's a girl at Pontchartrain Animal Hospital who lost 4 fingers because a Neapolitan Mastiff bit her hand under sedation during a painful procedure. Woke up, grabbed her hand, bit 3 fingers off, went immediately back to sleep. Don't let that be you. Tell your doctor, I ain't doing this shit unless you provide me adequate pain control along with this sedation. PSA. All right. Local anesthetics. Bupivacaine is your main one. There's also lidocaine, but bupivacaine, that's the better one. Bupivacaine is an injectable drug that is injected around the procedure site. What it does is it blocks nerve impulses from being perceived in the brain. So it creates a loss of sensation. Bupivacaine is used in epidurals, spinal blocks, ring blocks, dental blocks, and just basic blocks around the skin for minor procedures. We can't explain to our patients that we're like doing a block on them and that they need to stay still, because even with the block, they're still going to want to move around. So if you are doing a local anesthetic and you don't have a sedated or anesthetized patient, I would recommend that you give them a little something to like at least take the edge off, to let them like help them stay still a little bit, especially if the procedure is going to be long. But there are times where you're going to use local anesthetics on already anesthetized patients, like dentals, like ring blocks on amputations and shit. Also, bupivacaine can sting. So when you're first injecting your local anesthetic, I didn't even put that in here, I don't know why. When you're first injecting your local anesthetic, it's going to burn like hell for a second, but then that burn goes away because everything gets numb. Just letting you know. I hear that you can cut it with sodium bicarb. I've never tried, though. I hear that you can cut your bupivacaine with sodium bicarb and it won't burn. I've never experimented. Ooh, all right. Let's talk about Dexdome and Antecedent. Damn, I love Dexdomitor and Antecedent. God damn, some of my favorite drugs on the planet. All right, Dexdomitor, also known as dexmedetomidine. This is an injectable sedative that it's labeled as having slight analgesic pain management properties. Don't. They're so slight to pretend that it doesn't. Pretend that Dexdome doesn't have any analgesic properties. If you're gonna sedate something on Dexdome, fucking put mixed torb in there. Put some butorphanol in that bitch. It gives beautiful, gorgeous, lovely sedation. You can give it IV or IM. I don't recommend doing it solo. If you're doing anything painful, cut it with some torb. I love it with torb. It causes a very level playing field of sedation. Don't get alarmed. It does cause pretty intense vasoconstriction. So it narrows the blood vessels, which increases our blood pressure. And because we have that vasoconstriction, the heart doesn't have to work as hard. So there is decreased cardiac output. So on patients who have gotten Dexdomitor, you are going to see markedly decreased bradycardia. Like you're going to see decreased heart rate markedly. Like a dramatic drop in heart rate. This is a normal physiological response to the Dexdomitor. This is a normal physiological response to vasoconstriction. This is not pathological, and this does not need to be corrected. Do not give fucking anticholinergics. Don't give damn atropine on patients who are on Dexdomitor. It is not going to help you. You are not going to increase your heart rate. You are just going to compromise your patient. Your patient's heart rate is low because their blood vessels are constricted and their heart doesn't need to do as much work anymore. It is a normal physiological response. Do not freak out about the bradycardia in Dexdomitor. Unless, of course, you got a heart rate of like 20. But here's the beauty of Dexdomitor. You got a reversal! Girl, look right there! That's antecedent! Dexdomitor can be immediately reversed with antecedent. You just pop this IM. Dexdomitor can be given IM or IV. Antecedent can only be given IM unless you have an anesthetic emergency. So if you got a patient that's dying and they have Dexdomitor on board, then you can give antecedent IV. Other than that, don't do it. Give it IM. Give the antecedent IM. And something that I didn't even notice, and somebody pointed out to me in one of my veterinary anesthesia groups, and I've been like looking at Dexdomitor for years, and when they pointed it out, I had to go run to the drug cabinet and look and see for myself, and damn, they were right. All right, look, check it out. This is going to be so stupid, but we're going to take time. We're going to take a moment. Look at this Dexdome box. The dog and the cat are asleep. Look at this antecedent box. Oh, they are awake and alert. Oh my God. The attention to detail. Who designed this packaging? I love it. I fucking love it. All right. Acepromazine. This is an old school drug that is still in rotation for things that it shouldn't be in rotation for. Acepromazine is a tranquilizer that also has antiemetic, so anti-nausea properties. So it is great to use as a pre-anesthetic drug. So a drug that's given before we give anesthesia so it can reduce the amount of anesthetic that's needed, and it also helps prevent some vomiting. Acepromazine used to be touted as an anti-anxiety drug. That is not true. That acepromazine is not an anti-anxiety medication. Acepromazine is a tranquilizer. Acepromazine does not have any effect on the mental state of a patient. So when we give acepromazine and you see this really like depressed patient and they're very slow and they're sluggish and they look very drunk, acepromazine is literally only a physical medication. It is only creating physical change. It is not creating any change in that patient's mental state. So we don't ever want to like send this drug home as a sole anti-anxiety medication for dogs that are like scared of fireworks or like or scared of like going to the groomer or whatever, because we're actually not helping them with their anxiety. Like we're just making them like incapable of walking and moving around properly while they're still absolutely terrified, right? So acepromazine really should only be used basically in a pre-anesthetic setting and should be taken out of the rotation of being used as like a fucking anti-anxiety, pre-groomer, pre-vet, firework drug that is old school. We've proven that it doesn't do shit. It's actually detrimental to our patients. We're only making them more freaked out. There is like 1,000,008 other million better drug combinations that we could do besides old ass acepromazine. Leave it alone. Let it be a damn pre-anesthetic tranquilizer and antiemetic and leave it at that. And that was my PSA on acepromazine. Ooh, benzos. All right, so you got your PAMs, your LAMs, your PAMs and your LAMs. So that's your benzos. So diazepam, which is Valium. So this comes in injectables and orals. This is a class 5 controlled drug. It is used as a pre-anesthetic. It can be used as a sedative. It can be used as a muscle relaxer. It is an appetite stimulant in cats. It is an anticonvulsant for rescue treatment and seizures. So typically when we're using diazepam in the sense of anesthesia, we are pairing it with another drug like maybe ketamine, so we can provide like multimodal anesthesia, because on its own diazepam does not produce full anesthesia. It's just a sedative. We need to pair it with something like usually like ketamine. And then we have midazolam. So midazolam is an injectable drug that's basically identical to diazepam, but midazolam, even though they're both 5 mg per mil, midazolam is a little bit more potent, but it doesn't last as long. It's got a short duration of action. Midazolam and diazepam bind to plastic. So you cannot pull up a dose of diazepam. Let's say you got a dog that has seizures in hospital, right? And you're worried that he's going to have a seizure. And you want to have a dose of diazepam pre-pulled or a dose of diazepam at the ready for him in case he seizes, so you could just swoop in and give him the diazepam the second he seizes. You cannot pre-pull your diazepam in a syringe. It binds to plastic. It's not going to be as effective. Diazepam cannot sit in plastic. It just can't. You can't pre-pull it. It just don't work. Insulin neither. I didn't even mention that on my insulin slide, actually, now to think about it. Insulin can't be pre-pulled. So if you got somebody pet sitting and you got a dog on insulin and you don't think that they know what a fucking unit is, you cannot pre-pull up syringes for the week. Your insulin is not going to work. It's going to go bad. All right, and yeah, alprazolam. So this is an oral medication. It is a class 4 controlled drug. This drug is a true anti-anxiety medication. So this can be used in dogs and cats. It works by suppressing the central nervous system, and it's effective at calming dogs with things like noise aversion, phobias, things like being scared of going to the vet and stuff. Like this is the drug that you want to go for. Your alprazolam, your trazodone, like things like that. Not fucking doo-doo ass acepromazine. Acepromazine has a time and a place. Boy, anti-anxiety ain't one of them. All right, anesthetic, induction agents. Now we're to the real anesthetics, like the actual class of anesthetics. So dissociative anesthetics. Ketamine. So this is an injectable drug. You can give it IM or IV. Heads up, it burns like a bitch given IM. I've poked myself with it. It fucking stings. This is a class 3 controlled drug. This is an anesthetic induction agent, right? So when we give it, it puts our patients under general anesthesia. But aside from its ability to put us under general anesthesia, it is also great pain control. It has great analgesic properties. So because it's a beautiful, longer lasting anesthetic agent and it provides great pain control, this means we don't need to use as much inhalant gases, right? So this is why we love to do multimodal anesthesia. We use a little bit of a lot of things so we don't have to use a lot of bit of one thing. So we reduce all the negative side effects of all these drugs. We can just use a little bit so we don't get like the extreme bradycardia of Dexdome when I mix it with ketamine and butorphanol, and I don't get the extreme catalepsy of ketamine when I mix it with fucking Valium, and I don't get the extreme hypotension and blood pressure drop with isoflurane because I can keep my ISO at 1% because I have KDT helping me keep my patient under anesthesia. It's just a beautiful picture, and it all just comes together beautifully. So ketamine, again, even though it is a true anesthetic agent, and back in the gap, old school vets used to just be giving ketamine straight up with nothing else because, it's a good pain control, it's an anesthetic. It's best to give it alongside of another drug because you got some bizarre weirdo effects that ketamine can do, like catalepsy, where everything is stiff and weird. And then we got propofol. So propofol is this is a drug that killed Michael Jackson. This is an injectable drug. It's IV only. So also, this is the only drug that's white that can go IV. Nothing else can. Everything else that goes IV is clear. So propofol produces very rapid anesthetic induction. So the second you start pushing propofol, your patient's going to sleep immediately. Your patient's getting induced. But when you're given propofol, you have to titrate it. So what that means is when I pull up my dose for propofol, let's say my dog needs 4 mils of propofol. I'm pulling up my 4 mils. I got my 4 mils in my syringe. I'm sticking my needle in his IV catheter. I'm about to knock his ass out. Well, I'm going to titrate. So instead of giving my 4 mils, I'm going to give 2 mils and wait 10 seconds. So I'm going to get half my dose. After my 10 seconds, I'm going to give 1 mil. So another half of what's in my syringe. Then after another 10 seconds, I'm going to give a half a mil. So another half of what's in my syringe. So I'm going to give a half of my drug, 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 and so on until my patient is properly anesthetized. So he's got no jaw tone, no palpebral reflex. I'm able to intubate him without any resistance. Because if I take that whole 4 mil syringe and push propofol, and I just push it right in his vein, he is going to not breathe for a while. So propofol at induction causes apnea, which means no breathing. Even when you titrate it, it can sometimes cause apnea. But if you fucking push propofol super quick, boy, they're really not going to breathe for a hot second. So you always want to titrate your propofol to kind of reduce that apnea from showing up. Also, propofol, even though it has a super rapid induction, it has such a short duration. The clinical effects, they go away in like 3 minutes. So by the time you're done titrating this drug, putting this trach tube in, flipping your pet over, and hooking him to the anesthesia machine, and putting a pulse ox on him, the propofol is already worn off. Like, he's already, like, no longer on propofol. So that's why you want to have really good pre-anesthetic whenever you're using propofol, because if you just straight up give propofol and then nothing else, your patient is only going to be on anesthetic gas and nothing else. So you're going to have to turn your gas up super high. And you don't want to turn your gas up super high. So you want to have a good multimodal anesthetic plan where you've given really good pain control and a really good sedative pre-op, so that way the only thing that's keeping you afloat isn't fucking ISO in your anesthesia machine. Which leads me to ISO. So ISO is a general anesthetic, just like the other two were general anesthetics. So it is a clear, colorless liquid that is poured into a vaporizer that's on an anesthesia machine. And the vaporizer then vaporizes it into an inhalant gas that is carried by oxygen. And it is used to maintain general anesthesia on anesthetized patients via an endotracheal tube or an oxygen mask. So the dose of isoflurane is measured by percentages. So there's like a twisty knob on the vaporizer that you can change at will. You can modify it any time according to the needs of your patient. So if your patient's light, you can crank it up. If your patient's too deep, you can turn it down. Isoflurane is not an induction agent. Isoflurane should never be administered to a patient that has not received adequate injectable anesthetic drugs first. Do not put a cat in a box that has not received any kind of anything and then stick a hose in there and then turn the anesthesia machine on a 5-at-5. Do not do that. That is dangerous. That is outdated. That is poor medicine. Boxing animals down, mask inductions. No. Mask inductions and chamber inductions take so long. They pass through the planes of anesthesia so slowly. They go through this excitement phase where they freak out. They smash their head everywhere. Their blood pressure goes through the roof. And then it takes so much anesthetic gas to get them down that by the time that they're down, the ISO is causing so much hypotension. Their blood pressure drops so drastically because so much isoflurane is needed to get them down, because they've been so excitable through that stage of excitement and while getting masked down. That's a no. Just don't ever do it. I'll send you research papers if you ever work for a doctor that wants to fucking box anything down in the future. Just call me and I'll come over there and I'll beat his ass, or I'll just make him a PowerPoint. So just don't ever do it. Don't ever let anybody convince you to do it. It's not safe for you. It's not safe for your patient. There is many safe, beautiful, gorgeous other ways. Anesthesia's lovely. Please don't ever mask induce or fucking box down a cat. Ever. That's been my TED Talk. Thanks, bruh.